I would like to call your attention to this quote, which I really like. I actually included it in my book. But this is by one of America's first female physicians. And here's what she said. Medication alone is not to be relied on. In one half of the cases, medicine is not needed or is worse than useless. I want to stop here real quick. We are not against medication, folks, not by any stretch. If you find someone who is from Africa and who has lived past the age of 5 like I have, 90.9% of them will say, 99.9% of them will say that that's somewhere along the line it was Western medicine, allopathic medicine that saved them, that saved their health, that helped them recover from disease. And of course, malaria is is the top killer in the world. And I, for one, almost died from malaria and typhoid fever and the other infections that afflict the third world. So by no means are we saying that medication is useless or that we do not support medication. However, like she said, medication alone is not to be relied on. Let me go on. Obedience to spiritual and physical laws, hygiene of the body and hygiene of the spirit is the surest warrant for health and happiness. And that's what we're going to be doing, folks. And that's what as we have all commonly said, this is our goal. We want to give you a complete picture. We want to show you that health is a large word. It combines not just what we know about the physical body, not just what we feel, but how we think, our emotions, our feelings, and also the spiritual as well. And so without much further ado, I'm just going to shut up and hand this over to Sherry to introduce our guest, to read his bio, and I'll be handing over to him.
Okay, I would be honored to. Dr. Koenig completed his Professor of Medicine. He is also a registered nurse. Dr. Koenig is founder and former director of Duke University's Center for the Study of Religion, Spirituality, and Health, and is founding co-director of the current Center for Spirituality, Theology, and Health at Duke University Medical Center. He has published extensively in the fields of mental health, geriatrics, and religion, with close to 350 scientific peer-reviewed articles and book chapters, and nearly 40 books in print or in preparation. He is the former editor-in-chief of the International Journal of Psychiatry and Medicine and of Science and Theology News. His research on religion, health, and ethical issues in medicine has been featured on over 50 national and international TV news programs, including The Today Show, ABC's World News Tonight, and several times on Good Morning America. Over 100 national or international radio programs, including multiple NPR and BBC interviews, and hundreds of national and international newspaper or magazine articles, including cover stories for Reader's Digest, Parade Magazine, and Newsweek. Dr. Koenig has given testimony before the U.S. Senate and the U.S. House of Representatives concerning the effects of religious involvement on public health. He's been interviewed by Dr. James Dobson of Focus on the Family and by Robert Schuller in the Crystal Cathedral on the Hour of Power. Dr. Koenig has been nominated twice for the Templeton Prize for Progress in Religion. Dr. Koenig, welcome to Building Strength Webinars. Are you there?
Yes, Sherry. Thank you for that wonderful introduction.
You're very welcome.
Should I take it away?
Yes, we're handing it over.
Okay. Well, here we go. I'm going to see if my screen here works and if I can advance things. Okay, there we go. What I'm going to talk to you all about tonight is, first of all, we'll define some of the terms I'll be using, such as religion and spirituality. We'll look at some stressors in society that are now affecting health. We'll look at the role that religion plays as a coping behavior. Look at connections between religion, depression, quality of life, alcohol and drug abuse, crime, delinquency. We'll also look at some connections between religious involvement and health behaviors, as well as looking at physical health and recovery from illness. Then I'll go over some individual applications, some applications for health professionals, and then point to some further resources. So that's kind of what the program is going to be. So unfortunately, I have to start with definitions. I would just as soon not do that if I could, because when you start defining things, you immediately, your definition is different from other people's definition. So when you're talking about religion and spirituality, these things are held very intensely. We believe our faith and our beliefs about spiritual things, we hold that very dear to us. And when somebody starts, mucking around with definitions, then we're going to be a little suspicious. But in any case, since I'm a researcher, I'm going to kind of focus on the definitions as they would apply to research, and then also talk a little bit about how you would apply, how you would talk about this in clinical practice as well. So let's start out with looking at religion. Religion involves beliefs, practices, and rituals related to the transcendent, where the transcendent is that which relates to the mystical, the supernatural, or God in Western religious traditions, or to divinities, ultimate truth, reality, or enlightenment in the Eastern traditions. Religion may also involve beliefs about spirits, angels, demons. Religions usually have specific beliefs about the life after death and rules about conduct that guide behaviors within a social group. Religion is often organized and practiced within a community, but it can also be practiced alone and in private, outside of any institution. Now, the thing about religion is that it's a unique construct whose definition is generally agreed upon. It can be measured and examined in relationship to mental and physical health outcomes. So this term religion, I'll be using it a lot in this presentation. One of the reasons is because, it's well defined, and we can pretty much agree on what that is. So when I talk about relationships with health outcomes, it's going to make some sense. Okay, so next, spirituality. Now, spirituality is a concept which today is viewed as broader and more inclusive than religion. It's a term more popular today, much more so than religion. Religion is, seen as something that's divisive and causes conflict and wars, and spirituality is seen as, more something that we have in common, but the problem is it's hard to define what exactly it is. It is considered personal, something that individuals can many times define for themselves, that may be free of the rules, regulations, and responsibilities that are associated with religion. Now, the term spirituality is most useful in clinical settings. And I know there are probably a lot of people, who are listening who take care of patients. And so when you talk to patients, you're going to want to use the language of spirituality, not religion. And the reason for doing that is because the goal of the clinician is to be welcoming and inclusive. And spirituality is a term that that kind of includes everybody. So it's a perfect term to use. Patients define it for themselves, and in that way, conversation can begin. And that's what you're, as a clinician, you're after conversation. You want to begin talking with the patient. You want them to describe kind of where they are on their spiritual path. And so it's great language to use the spirituality word. But because it is vague, nebulous, which is the benefit for its use in clinical settings, it's difficult to measure and quantify for research purposes, especially since the definition of spirituality has been changing. So it's a real challenge when you're conducting research to use the word spirituality, because it's not something that everyone agrees on, and it's not something that can be clearly defined and measured. So let me show you some examples of how this definition of spirituality is kind of a moving target because it's been changing. On the screen before you, this is the traditional historical understanding of the word spirituality. Through much of history, spirituality was a subset of religious people. It was actually the more deeply religious that was thought to be the spiritual person. We're talking about people like Mother Teresa, Gandhi, the Buddha, Muhammad. These are the deeply spiritual people. That's who this word spiritual would apply to. And oftentimes it was the clergy who were considered those who were spiritual in society. Now, in terms of doing research, this definition is very clear. You basically have a group of people. Well, you've got those who are deeply religious, and we call them spiritual, and we compare that group of people to people who are religious but not spiritual. These would be the more superficially religious people, not as deeply religious as the spiritual people are. And then there would be another group called secular people. So you've got these three groups. One group here, the spiritual, the religious who are not spiritual, and the secular. And you can then compare these three groups in terms of their mental health and their physical health. And in terms of their mental health, you could look at their positive emotions, the experience of positive emotions, and then also the experience of negative emotions. So defined in this way, spirituality and religion and the secular are all fine, and we agree upon these things, and we can measure it. Now, the challenge has been that the definition of spirituality has been changing. And here you can see in this next slide that spirituality has grown larger. See, the other one, it was kind of small, part of religion. Now it's grown outside of religion. So it not only includes people who are deeply religious, superficially religious, now it includes people who are not religious at all. And these are called spiritual, but not religious. Now, we can still do research on these three groups and compare them in terms of their mental health and physical health. We can look at basically people who consider themselves spiritual but not religious. We can look at people who consider themselves both spiritual and religious. And we can look at people who consider themselves neither spiritual nor religious. So again, these are discrete groups, and we can compare them in terms of their mental and physical health when conducting research. Now, the real challenge has been that spirituality has grown even larger. The reason being is that, you see, it's hard to define who the spiritual but not religious people are. It's hard to come up with a measure to define, these people as a group. And so what's happened is that spirituality has grown larger, and this is actually the modern understanding of it, and it's come to include aspects of mental health. So as part of the definition itself, the way spirituality is often measured is in terms of meaning and purpose in life, in terms of connectedness, in terms of a person's well-being, their peacefulness, these kinds of things. Now this presents a real challenge within research, because now we're kind of defining spirituality by mental health terms. We're defining it as something positive to begin with. So if you define something positive to begin with as being consisting of good mental health, you can no longer look at the relationship between spirituality and mental health, because now it's like correlating spirituality with itself. So if spirituality is defined as good mental health, and you try to look at the relationship with mental health, you will always find they're associated, because basically they're defined both in terms of mental health. You see, again, the challenge is that you're kind of loading spirituality up front with good mental health, and therefore when you compare spirituality with the secular, the poor secular people, they've got no chance in this, because you've already defined spirituality as all of these positive things. So naturally, the secular people are going to have less of this, because spirituality, these things are not part of, the definition of secular. So in any case, we cannot study spirituality when it's defined like this. Now, what's happened is that spirituality has grown even larger. It's basically now consisting of everyone. And now this is great from a clinical standpoint. This is exactly what you want, because you want to address, the spiritual issues in health care with everyone. So that's terrific. The problem is that you can't conduct research with this understanding of spirituality, because research has to define people in groups. It puts people in groups, and it compares things between those groups. And here you've only got one group. You've got the spiritual. You don't have any group to compare it to. So while it's a wonderful application from a clinical standpoint, it's virtually unresearchable. And I'm going to go back one slide. This is also a definition that is not researchable. So we're really stuck with either kind of these basically three categories of religious and spiritual but not religious, and secular, or we're stuck with the traditional historical understanding. So what I'm going to do is I'm going to provide you with the definition of spirituality now that hopefully kind of bridges a lot of gaps here. So here we go. Spirituality is distinguished from all other things, including humanism, values, morals, and mental health. Okay? So we're not including any of that as part of our definition of spirituality. It's different from all of those things. So it's distinguished from all other things by its connection to that which is sacred, the transcendent. So here we're bringing in the transcendent again. The transcendent is that which is outside of the self, and yet also within the self. And in Western traditions, it's called God, Allah, Hashem, or a higher power. And in the Eastern traditions, again, it's called ultimate truth, reality, and enlightenment. You can see that this definition of spirituality that I'm coming up with here is very similar to that of religion. So spirituality is intimately connected to the supernatural and to religion, although it also extends beyond it. It extends beyond religion and begins before it. It begins before religion. So spirituality includes a search for the transcendent. And so, and this is probably the most important paragraph here in the definition, and so it involves traveling along the path that leads from staunch non-belief, basically the atheist or the agnostic, to questioning, to those who are questioning about the transcendent, whether there is really anything other than just, what we're looking at here in this physical world, to belief, to devotion, all the way to surrender. So this includes the entire spectrum that people proceed along as they're moving along that spiritual path. And we're all somewhere on that path, and so now what we're trying to do in research is kind of identify where people are on that path and then see whether or not that's related to their health. Okay, so in conclusion from this kind of difficult part of the talk, and I tell you, when I give this talk to audiences, I always get, people always get upset by this section of it, but, we got to do it. We got to define it, because now we're going to talk about research very quickly now. So, in the first part of this talk on research, I'm going to be addressing relationships with health in terms of religion, since basically that is what's really been measured and looked at in terms of its relationship to health. In the second part, we're going to be discussing clinical applications. I will use the word spirituality, as this is a broader and more inclusive term. Okay, so now we're going to move right on to the research. But before we go on into and look at the research, looking at these connections between religion and health, let's kind of step back and look at what a lot of us are facing now. What are the issues in society that are now affecting our health? How might religious involvement relate to these issues? What does the research on religion, mental health, and physical health say? And then what can we do with this information? Okay, so I don't think anybody will disagree with me in the idea that stress and depression are common and increasing within society. Certainly there's a lot of us that are under increased stress due to the recent economic downturn. There's an increase in depression, in anxiety. The American Psychological Association did a recent survey, and about a quarter to a third of Americans are having a tough time. I mean, they lost. Some of them have lost jobs. Some of them have lost homes. They can't live the way they want to live. A lot of them can't afford health care. And so there's an increasing amount of depression. There's increasing debt and decreasing savings. Up until, in 2008, the savings rate was actually in the negative. So people were not saving anything. In fact, they were spending more than they were making. And this, creates a real problem when you consider that, we've got to, hopefully people will retire at some point and stop working. What are they going to live on? I'm not sure we can depend on our Social Security back in in 10 or 20 or 30 years. So it's really kind of, right. People are kind of facing a situation where, they're feeling very insecure. Mm-hmm. Now, youth are also facing many choices. I know I've got a 19-year-old and a 14-year-old, and gosh, they've got so many choices to make. The world provides them with so many things, and really there is not a lot of absolutes to guide them in those choices. Mm-hmm. And so they wonder what to do. I mean, these incredible movies that are now, they can go to a movie theater, and the visual effects, the sound effects are just incredible. Or they can watch a DVD at home, or they can get a video game and almost, be in the video now with some of this virtual reality games and 3D games. I mean, that is so attractive for young people. And, there's not a whole lot of reading going on. There's not a whole lot of getting together. What is this going to do to this next generation of young people? So I have concern about that, because this is, this generation of young people, those are going to be the people taking care of us. They're going to be taking care of us baby boomers. Now, are they going to be wanting to do that? Are they going to be able to do that?
It's a scary thought.
Yeah, this is worrisome. The population is aging and facing increasing health problems. So at a time when, when there are economic stresses, the whole population is getting older. And people are, us baby boomers are getting health problems. We're developing, heck, I've got arthritis, kind of a chronic pain syndrome. I'm diagnosed with prostate cancer about a year and a half ago. And, as you get older, I'm only in my mid-50s. So it's, so these health problems are challenging in coping with, as well in terms of getting access to health resources to take care of them. And again, as I said earlier, there's a lot of fear because nobody is really saving. We've begun to save more now in the last year, and in some respects that's kind of done our economy in the fact that we're saving. So it's kind of like a vicious cycle here that we're facing. But the bottom line here is that there's a lot of stress going on, and people are looking for ways to handle it. Now, stress and depression affect our physical health and our need for health services. So as we're worrying about what we're going to do when we retire, wondering if we can ever retire, wondering how we're going to pay for our health care, that worrying is actually making us sicker. So there is a whole bunch of research showing that stress increases the risk of having a heart attack, a myocardial infarction. And once you've got a heart attack, if you're stressed out or depressed, your chances of having another one are much higher. It's at least 3 times higher if you've got a heart attack and then, you get depressed or anxious, your risk goes way up. Hypertension is higher among people who are stressed. I mean, literally the word itself. Hypertension. A lot of tension. And, with hypertension, of course, then you run into problems with stroke. And stroke seems to be related to stress as well. You get stressed out enough that blood pressure shoots up, and before you know it, you're in real trouble. My dad died of a stroke, and he was disabled and in a nursing home for 3 years before he died. So that was very hard. He couldn't speak. He had trouble swallowing, all because of a stroke. So I'm real careful about my blood pressure. Next is susceptibility to infection. If you're stressed out, you are more likely to get an infection. I mean, you're going to be more likely to catch a cold. Even if you have an accident and you have a wound somewhere, or if you undergo an operation, if you're stressed out, that wound doesn't heal as quickly, and it's more susceptible to getting infected. They've done these studies with stress and wound healing even in young medical students. What they did was they took a group of young medical students and they put a surgical incision on the inside of their cheek. They actually took a little biopsy, and what they did that on the left side of the cheek during exam times. And then they looked at the speed of wound healing. That was a period of stress. They were taking their finals. These are these medical students who, having to pass these courses. And so they were under a lot of stress. And so they wanted to see what effect this would have on their healing of their wounds. Now these guys are in their, and gals are in their early 20s, so they're young. They're at the peak of their health. Then during the summer vacation, they did another surgical incision, but on the right side of the cheek, and then they looked at how fast that wound healed during the relatively low stress period of the summer. And what they found was that those wounds during the summer healed a lot quicker. They healed about 30 to 35%, about a third. It took them only about a third as long to heal as when those wounds were made during the exam times.
Wow.
You know, even in healthy young medical students, that's going to affect their healing. Now, imagine an older adult, middle-aged older adult, who has already got kind of, you know, their immune system isn't working as good because they're getting older, and they're already more susceptible to infection. Their wounds are not healing as quickly, and then, you know, they're under a tremendous amount of stress. Well, you know, you could see what could result. Stress also, believe it or not, increases the aging process. It actually makes our cells age much faster. This was a study published in the Proceedings for the National Academy of Sciences. This is the most prestigious journal probably in the world in the sciences. There's the Proceedings for the National Academy of Sciences. These are the top mainstream science journals in the world. So this study was published in that particular journal. And what that study found was that among women who are experiencing a lot of stress, that their cells were actually aging about 10 years faster than women who were not experiencing a lot of stress. So their bodies were actually aging 10 years faster because they were having this stress.
Wow.
So in any case, you know, if you want to stay young, lead a peaceful life and don't get stressed. That's, of course, easier said than done during these
Right.
Stress also and depression increase the length of hospital stay and the need for medical services. You know, when people get depressed, for example, and they're in the hospital, you know, first of all, their medical conditions often don't respond as well because of this effect that stress or depression has on this healing process, you know, but also they don't have any motivation. They don't want to get better. You know, they've given up if somebody is depressed in the hospital. You know, when you get depressed, you don't care anymore. You don't have any more hope. You don't have any more reason for living. You feel like your life is worthless and doesn't really matter anymore. And in many respects, you know, many people just want to die, and some could take their own lives when they're depressed. So the issue is that when people get depressed in the hospital, and don't think that depression is rare in the hospital. Another area that I do research on at Duke is depression in the hospitalized medically ill. We find that at Duke Hospital that about 50%, 1 out of every 2 patients, fulfills criteria for a depressive disorder. And it goes up among younger patients who are sick and in the hospital. So there's a lot of depression going on, and it's affecting their ability to recover from their illness, and it's increasing the length of their hospital stay, and it's adding to the cost of health services that we're providing that right now we just can't afford. So in any case, depression is not good, nor is stress. Now let's look at, you know, so far we've been kind of talking about stress and depression and its adverse effects. Now, what role does religious involvement have in all this? We're going to talk about that now. Okay, let's first of all kind of look at what is kind of the landscape with regard to religion in the United States. 93% of Americans believe in God or some higher power. So that's 9 out of 10 Americans. 89% report a affiliation with a religious organization. Now that may just be nominal. You know, they may just say, well, I'm Catholic or I'm Protestant or, you know, I'm a Baptist. You know, but still they identify themselves with a religious affiliation. 83% say that religion is fairly or very important to them. The very important group is about 60%. And believe it or not, that's been fairly constant within the Gallup. See, these are based on Gallup polls, and Gallup polls have been doing these surveys, these random surveys of the U.S. population since the 1930s. And while it's fluctuated somewhere between 60 and 70%, you know, it stays right in there, right in that. About 2/3 of Americans for the last 50 to 60 years have considered religion to be, you know, very important to them. 62% are actual members of a church, synagogue, or mosque. 58% pray every day, and 75% pray at least weekly. 40% or more attend religious services weekly or almost weekly, and over half of Americans attend religious services at least monthly. So there is a lot of religion kind of going on, religious beliefs and practices in this country. And
when was this poll taken, Dr. Koenig?
What effect is this going to have on health? What effect does this have on people's health? So let's look at this now.
Dr. Koenig?
Yes.
When was that last poll taken that you showed us?
Actually, the 93% figure, it's actually, it's 92% in the most recent survey, which is, actually it's 93% in the most, which was the Gallup poll in, I believe it was November of 2008. The Pew Foundation also did a massive study, 35,000 Americans. Their figure was 92%. So it's somewhere between 92 and 93%, and that is the latest data from the latest polls.
That's surprising. I would have thought it would have gotten less than this by now, from all the things going on.
Yeah, it is interesting. You know, with the secularization of society, you'd think
Right.
that it would be less, but it's amazing. You know, the average American out there, you know, trying to make it, is generally, you know, believing in God or a higher power is part of their life, and it's especially common among minorities. You know, and we're getting more and more minorities coming into the U.S., and it's probably 95% or above in minority groups.
Right.
So,
Okay.
Okay. Now, many people turn to religion to cope when they get stressed out. You know, when I was in my medicine residency, and I was taking care of patients in the hospital, I would ask them, what enables you to cope? And this was in Springfield, Illinois. This is just south of Chicago. And I was struck by the fact that many patients answered that question by talking about their religious faith. Now that surprised me as a young doctor. I had not had anything. I had no training at all. No, you know, in medical school or residency, nobody ever mentioned that that patients use religion to help them to cope, or that was something that was important to patients. That was just never mentioned in any of my training, either as a doctor or as a nurse. I was a nurse before I became a physician. And even as a nurse, there was no mention that religion or spirituality was anything of any relevance to the patient. And yet, you know, when I was talking to these patients, it seemed to me that it was pretty darn important. I mean, patients, when I asked them that question, what enables you to cope? You know, I mean, tears would come in their eyes, and they would say, Doc, it's my religious faith. You know, if I didn't believe in God, if I didn't pray, you know, I probably wouldn't be here now. I probably would be dead, or I would have committed suicide. I mean, I couldn't tell you how many patients answered that question in that way. And because of that, I got interested in doing research in this area. This was about 25 years ago, you know, that I was asking them how they were coping, and it was at a time when religion and spirituality were totally removed from anything in the medical care system, and certainly in mental health. You know, Freud said that religion was neurotic, And in the mental health area, they tried to get rid of religion because they thought that it was destabilizing. And so basically what I was hearing from patients was that this was something important to them and that this was helping them to cope. And for some of these patients, to me, just looking at them, it seemed like they were coping pretty well, given the incredible stress that they were under, and that religion seemed to be helping them some. So I wanted to study that and see whether or not, whether or not Freud was right or whether these patients that I was taking care of were right. So I began to study this, and one thing I came across was an interesting article in the New England Journal of Medicine, which is, that's the holy grail of all medical journals, the New England Journal of Medicine. What they found was that after September 11th, the most common way that Americans coped, or it was actually second only to talking with other people, the second most important way that Americans coped with September 11th is that they turned to religion. 90% turned to religion to cope. And this was published in the New England Journal of Medicine. This was in 2001.
Wow.
Now, in studies of medical patients in the hospital, I was thinking, okay, well, it's interesting that these patients are saying that religion helps them to cope, but I thought this isn't, let me do something systematic here. Let me do some research. So what I did was I began studying patients in the hospital and asking random samples of hospitalized patients. I mean, actually, random samples, consecutive admissions to the hospital, what enabled them to cope. And in those studies, what we found, both in the Midwest and also on the East Coast, was that about 90% of hospitalized patients relied on their religious faith to some degree to enable them to cope. And here at Duke Hospital, 4 out of 10 patients said it was the most important factor that enabled them to cope. So it was 42% said that religious belief, God, prayer, their faith community, that this was more important than anything else, including their family, including the doctors and the medicines, that yes, all of those other things help, but religion, when they were lying in bed at night and they were scared about what would be happening the next day, they talked to God or they prayed, and that brought them comfort. So that was then published in a series of papers in a number of medical journals. Now, since those studies that we did, there have literally been hundreds and hundreds of quantitative, in other words, studies that actually measured religious coping and then looked at health outcomes and looked at the correlation between the two, and qualitative studies where investigators would actually go into patients who were dying or with cancer or those who are maybe after a natural disaster. They would actually go into those scenes and they would ask people, what enables you to cope and what is it that helps you to keeps you going? And there have literally been hundreds of studies now confirming those findings, that many, many people, when they get sick, especially in minorities, especially among women, especially among the poor, they turn to their religious faith. That's how they cope. And research on the effects of religion on coping and health is growing rapidly around the world. In the last 10 years, when I got interested in this back 25 years ago, I almost lost my job because you weren't supposed to do this as a medical doctor, and then later on the faculty at a medical center at a university to study religion. It was called the anti-tenure factor. It was one way that you did that, there was no way you'd get tenure. In other words, that's what the professors all want. They want to get tenure.
Right.
Well, you'd get fired, lose your job, demoted, but in the last 10 years, things have really, really changed. And I've got a graph here now that shows you, let me explain this. on this side of the graph, you've got thousands of articles. And these are 5-year periods, 65 to 69, 70 to 74, 75 to 79. See these 5-year periods. And what this is graphing the non-cumulative, the total number of articles on religion, spirituality, and health published in peer-reviewed science journals in this 5-year period. So, between 60, let me give you an example. Between 65 and 69, there were 1.5, 1.6, somewhere in 1.4, or 1,400 articles published on religion, spirituality, and health. Now, about 20% of those were actual research studies. So between 70 and 74, again, it went up a little bit, 2,000 articles during those 5 years. Then it was about the same in 75, 79, about the same in 80 to 84. It began to increase a little bit here. Now it's up to like 3,000 articles during this 5-year period. But in the 90s, it began to increase quite a bit more. So now there's 4,000 articles published during this 5-year period. And then it began to take off, such that in the last 5 years, there have been 13,000 articles, 20% of which are research studies looking at the relationship between religion and health. Now, this is a dramatic increase in the amount of research that's now coming out looking at these connections. Now, I'm going to kind of summarize what some of this research has found. The first is that religious involvement can buffer stress, reduce depression, and enhance quality of life. Now, this is what I'm going to show you here. This is a systematic review of the literature published over the last 150 years. This is actually all compiled up until the year 2000 in the Handbook of Religion and Health, and then I'm actually compiling them over the next 10 years from 2000 to 2010 in the second edition of the Handbook of Religion and Health. This is Oxford University Press that's publishing it. So what the findings are, there have been a total of 324 quantitative studies looking at the relationship between religious involvement, spirituality, and depression. And of those 324 separate quantitative studies, 204 of those 324, about 2/3, find that depression is less common among those who are more religious, and even if the religious person does become depressed, and religious people do become depressed, there's no doubt about it, but they recover more quickly from depression than do less religious people. So this has actually been documented and shown in 200 studies, 200 separate studies published in journals like the American Journal of Psychiatry, Archives of Internal Medicine, Journal of Nervous and Mental Disease, American Journal of Public Health. These are the kinds of journals that are publishing these studies. Now, in terms of the positive side of mental health, in terms of well-being, happiness, meaning, purpose, and hope, these are the positive emotions that people experience. These are the kinds of emotions that make life worth living. You know, we all want to be happy. We want to have a happy life. Well, when studies look at factors that are related to happiness, to well-being, there have actually been now 359 studies, quantitative studies, that have looked at this relationship between religious or spiritual involvement and well-being or happiness. And of those 359 studies, 80%, 8 out of 10, show that the religious person has more positive emotions. They experience more happiness, more meaning and purpose in life. They have more hope in the setting, and a lot of times in stressful, difficult circumstances. They tend to have more hope than people who are less religiously involved. And in 20 of the 29 recent studies looking at quality of life, the religious or spiritual person has significantly higher quality of life. Now, these quality of life studies are typically done in people who are having some threat to their quality of life. In other words, people with severe heart failure, with cancer, with disabling conditions, physical conditions, with chronic mental illness, people who are dying, etc. They look at their quality of life. And in those settings, those people who have a religious faith, they do seem to be doing better, certainly in terms of their mental health. Also, religious involvement is related to less alcohol and drug use, especially among the young. There are 324 studies that have now been done, and of those, again, about 80 to 85% show that people who are more religious or spiritual are just less likely to use alcohol, to abuse alcohol, to use drugs, illicit drugs. They're just less likely to do it. And more than 50% of those studies were done in young people. So that means, you know, young people who are just starting out their life, just trying to get an education, just trying to, you know, go to high school and go to college and maybe, you know, apprentice on an occupation. Those are the people who are affected by these drugs and alcohol. It derails them. And it makes it so that, you know, they don't complete their education a lot of times. Or they have problems, you know, then getting a job. And then they can't afford health insurance. And, you know, it just goes on. And then they get addicted to these substances, and it destroys their lives. So
right.
The young person who is part of a faith community for whom religion is important to them, who prays and that's important to them, they're just not going to use as much alcohol or drugs as those kids who don't have that firm grounding. And again, you know, I'm not a preacher. I'm not, you know, I haven't had any religious training. I'm just a medical doctor. You know, I was trained in family medicine and then geriatric medicine and now in psychiatry, and I was a nurse before that. You know, that's my area. I'm interested in how people are coping, and it seems to me, based on this research that's published all over the world in these academic medical journals, that people are doing better, at least in terms of substance abuse and addictions, if they're more religious. And in fact, Alcoholics Anonymous is the most successful program of all time in terms of helping people recover from alcohol addictions, and central to its 12 steps is the spiritual principles of surrender, belief in a higher power, and admitting that you can't overcome this problem yourself and that you need help from something greater than you. And after you recognize this and you kind of confess that you can't handle this, you surrender to the higher power, and then the next step that you make is that you commit to help somebody else out who's also having this problem with alcohol. And that's been the secret to the success of Alcoholics Anonymous. And now they've got, you know, Narcotics Anonymous, and they've got Overeaters Anonymous, any addictions. This notion, you know, of once you're addicted to something, it really takes over. It takes over your life. It controls you. It imprisons you. And there are not many things that can get you free of that. But it does appear that through spiritual principles, at least, you know, from what we can tell so far, many people can kick these addictions. Okay. Now, let's go on. It appears also that religious people live healthier lifestyles. Now, in terms of cigarette smoking, let's just take this one thing, cigarette smoking. There have been 117 studies that have looked at the relationship between religious involvement and cigarette smoking. And almost every one of them shows that religious people just don't smoke as many cigarettes. They're less likely to start smoking, they're more likely to quit smoking, and they don't smoke as many cigarettes if they do smoke. So what's going to be a result of that one behavior alone? The result is going to be that there's going to be less lung cancer among religious people. There's also going to be less heart disease. There's going to be less high blood pressure because cigarette smoking is associated with every one of those things. Lung cancer, chronic lung disease, coronary artery disease, heart attacks, and hypertension. In addition to affecting, immune functioning and lowering your susceptibility to disease. So cigarette smoking is bad for your health. And groups that don't do that are naturally going to be healthier. The second thing is that religious people tend to exercise more. They are, in 4 of 6 studies, showed that, they were more likely to exercise, which is good for your health. Diet and weight. Now, this is the only problem with religious people. They tend to be heavier. I guess, since the one thing that you can do among religious, religiously you can eat. In fact, eating is encouraged. Whenever you go to a meeting or a potluck supper, boy, they really encourage you to eat. And if you don't eat, it's like you're offending your host or something. But,
right.
So, in any case, what we got to do is we got to get more carrots and celery into the potluck dinners. We got to have healthier meals as opposed to typically, what's in these meals. They're high calorie, high fat meals, and so the result is that there's a lot of overweight, problems among those who are religious. Now, they may be happy, overweight religious people, but that's not good for their health. So what's actually happening now is that there are a lot of faith-based initiatives within churches that are now starting to teach about healthy eating, about exercise, and about diet. And in that way, they're targeting members of churches who may be having problems with their weight and these kinds of things. Now, the next thing here is that the religious people are less likely to get involved in risky sexual practices, such as extramarital sex, and religious people have fewer sexual partners. They're just less likely, young people who are religious are less likely, they delay having sex for longer than kids who are not as religious. And, when you look at the studies out there, you find that of the 46 studies looking at the relationship between religious involvement, religious beliefs and practices, and sexual activities, 45 of 46 show that those who are more religious are just less likely to have these multiple partners, have extramarital sexual affairs, et cetera, et cetera. They're just more likely to have these relationships within the confines of their marriage. And of course, that has physical health consequences too, because, if you're having extramarital affairs, it's not likely that your marriage is going to last very long. And so
right.
when as you grow older, you may end up single and not have anybody around to help take care of you. And that's especially a problem for men these days. Not having a spouse to remind you to take your medications and take care of you can be a challenge. And those people who are religious are more likely to have marriages that are holding together, and they stay married longer. There is a lower divorce rate, and also if if people have fewer sexual partners, there's going to be less sexually transmitted diseases, and less AIDS, et cetera, et cetera. I mean, there are lots of consequences to risky sexual practices, both psychological, social, and physical. Okay, so next slide here is that marital stability is greater, less divorce, greater satisfaction and fulfillment and commitment within marriages among those who are religious. There are 39 studies prior to the year 2000. Those are in the Handbook of Religion and Health. And of those 39, 36 show that the religious are that's statistically significantly more likely to have stabler marriages. And not surprising in that case, social support is greater among those who are more religious. Of 20 studies prior to the year 2000, 19 of those 20 studies found that the religious person has greater social support, and this social support lasts longer when you really need it. In other words, like when you get sick. Religious people from their faith community tend to visit, tend to call, tend to support people who are sick a lot longer than do friends that are not religious, that are not part of this of a faith community. That's been shown over and over again. When you're playing bridge and you get sick and your chair, you can't play bridge that night, your chair is empty. It's not long before that seat is filled. But if you're part of a faith community and you don't show up at church, if it's one of these real faith communities that's really alive, they'll be checking on you and finding out what's wrong. And
right.
then, coming over and delivering meals and doing your laundry, et cetera, et cetera. That actually is what happened to me and my wife when we had our second child. And my wife, it was a complicated pregnancy. The baby was very irritable, and she was exhausted. And it was a time when I was in the middle of my academic life and trying to make tenure, basically, and I wasn't much help. But this church community came and they did our laundry, they mowed the grass, they brought meals every night. I mean, they brought so many meals, we had to tell them to stop bringing meals because the refrigerator got full. And so in any case, being part of a faith community helps this out. Now, consequently, what is the result of this greater social support? Shorter hospital stays, fewer hospital days per year. Reason being is that people have that support in the community so that they don't have to go to the hospital. They've got, again, family members and members of the faith community who are helping them and supporting them at home. Also, they are spending less time in nursing homes. And we actually did a study back in 2004. This was a consecutive sample of about 800 hospitalized patients at Duke, and we followed them for 9 to 10 months after they were discharged from the hospital, and we looked at how many days they spent in nursing homes or in rehabilitation settings after they were discharged. And we found that particularly among African Americans, there was a big difference between those patients who were praying regularly during their hospital stay compared to those who were not praying. Among African Americans who were not praying during their hospital stay, their average number of days in the 9-month period after hospital discharge that they spent in a nursing home was 50. They spent an average of 50 days in a nursing home during those 9 months. Among those who were praying at least once a day or more, praying, meditating, reading religious scriptures during the hospital stay, their average number of days during that 9-month period was only 5 days.
Wow.
That's a tenfold difference in amount of time spent in nursing homes based on their private religious practices during their hospital discharge, during their hospital stay. Now again, this was published in the Archives of Internal Medicine. This was one of the top medicine journals in the country.
Now, Dr. Koenig, this is fascinating information. Did they, in the research, did they show why this is so? I mean, was there like a, I'm probably asking too much here, but is there like a physiological reason for this? Is there a connection there?
That's a great question, David. One of the reasons we think is because those African Americans in particular who were praying during the hospital stay, these were older adults. These were all over the age of 50. That's not old as far as I'm concerned, but it's older than less than 50. But these patients who are praying, we think that we don't have data on this. This is all speculation. We think they came from more religious families, and we're assuming that these older adults who were more religious also trained their kids to be more religious. So in any case, we think that rather than put their parent or their spouse in a nursing home, they took care of them at home because of their religious beliefs. That's one factor. Another factor, as what we've found in other studies, is that religious people tend to be easier to care for. They tend to be more cooperative. They're more agreeable. They're less disagreeable. And so they're easier to care for. And so these families, not only did they feel perhaps a little more obligated to care for them at home, but they were easier to care for at home, so they didn't have to put them in a nursing home. And also probably because those patients had a little more hope. They were praying, they had faith, they had something to have hope in. And so, again, they weren't depressed, they weren't irritable and grumpy. They were, they were hopeful. And so, again, they were easier to take care of. So anyway, I don't know, but that's the speculation so far.
That seems plausible. Very plausible.
Yeah. Okay, so let's now look at, and this is actually the part that, most people think, okay, now it makes sense to me that probably religious people have more social support. Yes, they're more, socially involved. They go to church, et cetera, et cetera. Yes, they may have a little bit more hope, and they may cope a little better because, believing in God or a higher power, and believing in life after death, and people who suffer, they probably cope a little better. But what most people don't really realize is that this religious coping seems to have physical health consequences in addition to having these social and psychological benefits. So now let's look at some research that's looked at this relationship between religious involvement and physical health. It appears that religious involvement is related to fewer heart attacks and fewer deaths from coronary artery disease. Now, the reason for that is probably because they're less stressed and less depressed. And so, when people get stressed out, their adrenaline starts flowing. When you get depressed, your cortisol increases. And with all that adrenaline going around, that's actually probably making it easier to have a heart attack. Not only does adrenaline increase the blood pressure and constrict the vessels, it also makes the blood more hypercoagulable. In other words, blood clots form easier. So if you're, on the verge of, if you've got a narrow coronary artery and you're stressed out, that blood is going to clot sooner, and so you're going to have a heart attack. Now, if you're coping better, if you have faith, if you have hope, if you have meaning and purpose in your life, then that stress isn't going to be as high, and so you're going to have less frequent coronary events. And that's what at least a couple of studies seem to show. Also, a couple of studies show that people recover better from cardiac surgery and have fewer complications. These are studies out of Dartmouth and also out of Rutgers. There have been a series of studies looking at open heart surgery and survival 6 months after the open heart surgery. And those people who are relying on their religious faith to cope are just, they live longer after cardiac surgery in this Dartmouth study, and they have fewer surgical complications in the Rutgers study. Lower cardiovascular reactivity to laboratory-induced stress. So what they do in these studies, they stress people in a laboratory. You know, I don't know what they do. They give them some kind of mental arithmetic test, or they scare them, or they do something that causes them to feel stressed out. And what they do is they can measure this stress by the degree, how much their heart rate goes up, and also how much their blood pressure goes up. Now, people who have a high degree of cardiovascular reactivity, they are more susceptible to having heart attacks, having high blood pressure, and having strokes. We know that. We know that cardiovascular reactivity predisposes to these negative cardiovascular events. Now, when you take religious people and compare them to non-religious people in these laboratory settings, religious people have lower cardiovascular reactivity to the laboratory stressor. Their blood pressure doesn't go up as high. Their heart rate doesn't go up as high. And so, in any case, that's interesting because, you know, you can kind of control that in the laboratory and test that out. Religious people tend to have lower blood pressure. There's one study that actually shows they have fewer strokes. This was out of Yale. This was the Yale Health and Aging Study. 3,000 older adults followed for a period of 6 years, and those with the lowest rate of stroke were those who were attending religious services at least weekly. Religious people tend to have fewer metabolic problems, like problems with their blood sugar. They have better immune functioning. Their immune systems tend to work better. That's been shown in women with metastatic breast cancer, in men who are HIV positive or who have AIDS. It's been shown in women with fibromyalgia, among aging adults, and you know, and in other different conditions, that the immune functioning seems to be better among those who are more religious. Studies show that there are lower hormone levels in the blood among those who are more religious. In other words, stress hormone levels. We're talking about things like cortisol. Cortisol levels appear to be lower among those who are more religious. There are a few studies, not as many studies as with the cardiovascular diseases, but there are a few studies showing that cancer, there are lower rates of cancer and among those who are more religious, and that people survive longer with cancer if they have a strong religious faith or are involved in a faith community. Now, there aren't as many studies showing that as there are studies showing, you know, with the cardiovascular disorders, but it would make sense given that the immune system tends to contain cancer, and if your immune system is working a little better, you know, it seems like that cancer might not come back. I'm certainly hoping that's the case for myself with this prostate cancer. But you know, I'm hoping that studying the relationship between religion and health has this same benefit. We'll see. Okay, less susceptibility to infection, greater longevity, slower cognitive decline with aging, and less functional disability as people age. Let's look at some of these studies, some of these individual studies. These studies are fascinating. On your screen is the actual citation in the medical journal where you can find these studies. Religious attendance associated with a slowing of cognitive decline with aging among older Mexican Americans. So this study showed that, you know, people attending church more often, independent of other factors, they were not losing their memory as quickly as everybody else was who weren't attending religious services. That's now been shown in at least 2 studies. Here's a study published in the journal Neurology which is the top neurology journal, in the country. This is the American Association of Neurologists that publishes this journal. They were able to show that religious behaviors, particularly these private religious behaviors like praying, was associated with a slowing in the speed at which Alzheimer's disease progressed. This was done in a Alzheimer's center in Toronto, Canada. This next one by Contrada in Health Psychology, this is the citation for the fewer surgical complications following cardiac surgery. This next one in the Annals of Epidemiology, this was a Jewish sample. These are all Jews, and this was done in Israel. And what they found was that that basically, if there was a higher concentration of people in a community that were affiliated with a religious organization, that were, involved in their Jewish temple or whatever, that everybody's health got better. So this was good news for the atheists, and that they don't even have to be religious, but they better be sure that their neighbor is religious, according to this study.
By association, huh?
Yeah, because, according to this study, you didn't have to be religious, but if you were living in a religious community, you would live longer, simply by association. Probably had something to do with social capital, and that these communities with a high concentration of religiously affiliated people, that there was probably less crime, less teenage pregnancy, these kinds of things, more trust within the community. That's called social capital, and that is strongly correlated with the concentration of religiously affiliated people. Here's one published in the British Medical Journal. This is another one of the top medical journals in the world. They were able to show that teenagers who were attending religious services were protected from meningococcal meningitis. Meningococcal meningitis is a disease that young people who live in closed communities often have, and it's a fatal disease a lot of times unless you get immediate help. This is in boarding schools, in the Army. Meningococcal disease can be a real problem. We even had meningococcal outbreak here at Duke during basketball season, when all the Duke students were all, waiting, or they were in their tents outside waiting to get into the basketball game. But basically, these teenagers were protected against meningococcal disease to the same extent as teenagers who were vaccinated against the meningococcal bacteria. So this is pretty amazing, a pretty amazing finding. Here's another study. This is done by Gail Ironson at the University of Miami. This was in the Journal of General Internal Medicine. Fascinating study of people who are HIV positive or those with AIDS. She was able to show that if a patient, when they were diagnosed with being HIV positive, if they turned to spirituality or religion after their diagnosis, that 4 years later they had higher CD4 counts. The CD4 count is a measure of immune functioning, and they had fewer viruses in their blood. So religion, as opposed to turning away or staying the same, if they turn to religion or spirituality at the time of their diagnosis, 4 years later, they were significantly more likely to have better immune functioning and fewer viruses in their blood. So this is another one of those kind of amazing studies that you wouldn't anticipate. You wouldn't think this.
Right.
Unless somebody actually did a study. There have been a couple of studies here in other areas of the world besides the United States showing that religion seems to be associated with greater longevity overall. This was done in Denmark, this one up here in social science and medicine. Then there's another one done in Israel showing that synagogue attenders were, significantly more likely to live longer. Now, I know we're getting close to our end here, but I want to go over a few other slides here. One is this fascinating study looking at longevity among California Mormons. You know, this is a large random sample. You know that Mormons, now this is divided by males and females. Mormon males who attend church weekly, never smoke, are married, and have 12 years of education or more, they have a 55% lower standardized mortality ratio, which translates into an average life expectancy of 84 years. That is 10 years longer than life expectancy for U.S. whites in general. So those Mormon males live an average of 10 years longer if they attend church weekly, never smoke, are married, and have 12 years of education. Now, here's the good news. You don't have to be a Mormon to derive these benefits, because in this particular study, published in Preventative Medicine last year, what they found was that if you were a U.S. white male and you attended church weekly and you never smoked and you were married and you have 12 years or more of education, basically the same profile as the Mormon male, you basically had the same standardized mortality ratio as the Mormon male. In other words, your life expectancy would be 84 years as well, and you don't have to be Mormon. It's just that you need to be attending church weekly, not smoking, married, and having at least 12 years of education. Now, in fact, if you were a woman, you had similar benefits if you were a Mormon female, but not quite as strong as Mormon males did. Among Mormons, apparently the male has a little bit, higher prestige than the woman does, and so being a religious male, you have more benefits than women do, and it actually reflects in their life expectancy. So, for the Mormon female, the average life expectancy for the woman that never smokes, attends weekly, married, 12 years education, is 81 years. Is 86 years for the Mormon females. Now, if you're not Mormon and you're a woman, you're a white woman, your life expectancy is 86 years or longer if you attend weekly, never smoke, married, and have 12 years of education. So you can see from this large study, this is a random national sample of the U.S. population, that religious involvement works together with health behaviors. Okay?
And it doesn't matter.
It's additive in terms of the health benefits and the addition to the lifespan.
And it doesn't matter. It doesn't matter what kind of denomination or what church or religious group you're talking about. This is constant, regardless.
Regardless. You can be as long as you're attending religious services weekly, you don't smoke, you're married, and you got 12 years of education. Your average life expectancy, if you're a male, regardless of your denomination, is 84 years, and if you're a female, is beyond 86 years.
Wow. Why 12 years? Why 12 years education?
I think the education helps because then you're more aware of different health benefits. You're probably more likely to exercise because you're more aware about issues related to health. It has to do with health education, I think.
Okay.
Yeah, that's my understanding. Now, why is religion related to greater longevity? Why is this? This is the question. Now, in this slide, we have a clue. On January 3rd, 2009, after the death of the Guinness Book of World Records oldest person, Maria de Jesus, who was 115, next in line was Gertrude Baines from Los Angeles. Born to slaves near Atlanta in 1894, she was described at 114 as spry, cheerful, and talkative. Now this appeared on CNN on January 3rd. When she was 112 years old, Mrs. Baines was asked by a CNN correspondent to explain why she thought she had lived so long. Her answer: God. Ask Him. I took good care of myself the way He wanted me to. So,
Good answer.
That summarizes it up right there.
Yeah.
Living a healthy life, having faith, and living the way God wants you to live. That's what she thought. Now, very quickly, I'm not gonna dwell on this because I want to go on to the clinical applications because I'm sure people are getting tired now and probably got other things to do, including going to bed. But in any case, here is a model that explains how religion influences health. This is a theoretical model that kind of describes the pathways and the different constructs along the pathway to explain how religion affects health. Now, the model that I'm using here is based in the Judeo-Christian Islamic tradition, which views God as separate from humans and creation, yet as personal and immanent. So it's kind of from that viewpoint. Now, similar models exist for those from Eastern religious traditions with a broader views of the divine as well. But this particular model I'm going to show you is based in more the Christian, the Islamic, the Jewish tradition that views God as separate from the creation. So this is a complicated slide, but it's an attempt to understand all of the factors that influence a person's physical health and wellness, all of the different factors. Now, in terms of their spirituality, which I largely kind of talk about in terms of their religious practices, the source or the initiating thing that begins, that starts this positive process whereby spirituality or religion influence ultimately mental health and physical health, is belief in, relationship to, and attachment to God. This connection to God is what then spurs on a person's religious commitment. It motivates them to involve themselves in private religious practices. It motivates them to attend religious services. It provides them with religious experiences. It enables them to use their faith when coping with stress and illness. So the source of all this is this connection with God. Now, I'm not talking about something supernatural here. I'm talking about something that we can study, we can examine, we can ask people questions about how deep and how close and how important their relationship to God is. We can measure that, and then we can test this in these various models. Now, once these things are active, initiated by this connection with God, this then helps people to make better decisions in terms of forgiveness, forgiving others, in terms of loving others, in terms of doing good things, volunteering, helping your neighbor, gratefulness, being grateful. These behaviors, kind of these moral behaviors, enhance one's positive emotions and cognitions. They enhance the social support and the connections. When you forgive people, when you do good things for other people, you got more friends. You know, I mean, these are the people who have got a lot more friends who, you know, you forgive, you're not as grumpy, you know, you feel better, you have more positive emotions, you're grateful, you experience more joy, less dissatisfaction because you're focusing on things that you're grateful for, and so consequently you have more positive emotions, you have fewer negative emotions, and you have more social connection. Now, all of these things are known to affect immune, endocrine, and cardiovascular functions, which then in turn influence physical health. Of course, all of this is also influenced by our genetics, by our temperament, and by our life experiences, as well as by our lifestyle choices and health behaviors. Now, this is a little bit more detailed. This here kind of expands this model and makes it a little more detailed. So again, here is your source, this connection, this attachment to God, which is influenced by life experiences. And also, this attachment is influenced by family influences, whether or not your family raised you in terms of a religious belief system. Also, adult and peer influences are going to influence this development of this attachment or relationship to God, and will ultimately influence the decision on whether or not to commit to a religious belief system, and therefore consequently become engaged in all of these activities. Actually, we are learning that genetics seems to influence this capacity to have religious or spiritual experiences. There are some people who just are more likely to have these experiences. And so believing in God is just a little bit easier for those people than for people who don't have a certain set of genes. So there is some evidence now looking at what's called epigenetics, or the relationship that the environment has on genetic expression. And it does seem that genetics both influence religious involvement and are influenced by religious involvement. There's this fascinating study that shows that this is in mother rats. This is a laboratory, mother rats. Mother rats that lick their babies, that lick their babies when they're young, that actually changes the genetic code. It actually puts what's called a methyl group on the DNA sequence of the genes. It adds a methyl group, which later on in life, having this methyl group on the DNA sequence actually enables this baby rat to be hardier and to survive longer than if they didn't have this methyl group, which was caused by the mother licking and grooming the baby rat. Now,
that's fascinating.
Isn't that fascinating?
That is fascinating.
That baby rat then, when it grows up, then transmits that DNA with the methyl group to its children. So basically, if a mother provides a nourishing environment for a child, and now they haven't done this with humans yet, but you know, if it works this way with mammals, then they could actually transmit potentially through the generations the influence of perhaps a nurturing religious or spiritual environment may have this same effect. Now, this hasn't been studied yet, but it's fascinating, you know, the possibility.
Right.
Yeah. So, okay. Then this religious involvement might influence the choices people make. Again, you know, altruistic, forgiving, dependable, grateful, honest, patient. You know, choices are going to influence this, which then influence health, behavior, social support, mental health, and then physical health. So that's basically kind of how it works. Now, I'm going to kind of do these applications fairly quickly, but in terms of...
Dr. Koenig?
Yes.
Please don't you don't need to rush this. Like we said, people have to look at this over and over again anyway. So don't feel rushed at all. we're
Okay,
we're here.
I'll not rush too quickly then.
Okay.
Now, what can people listening to this webinar, what can they take away from this? You know, I've thought about this. I thought, you know, as I was preparing this talk, what should people take away from this? Well, one is to just be aware and stay updated on the research, which is rapidly expanding and providing new information. You know, learn more about this research connecting religious and spiritual factors and physical and mental health. Try to understand it a little better. It's a fascinating area. We're all concerned with our health, and, you know, many of us, at least in the U.S., over 90% have some belief in God or a higher power. And so this kind of connects those two things, and so stay updated on that research. If you're religious, then recognize that your involvement and development of this area of your life may affect your health, and may affect your health in a positive way. So if you are already religious, then just be aware that this can influence your health in a positive way. Not that it always does, not that it never causes negative things in terms of health, in terms of mental health. It can, but in general, devout religious practice and involvement within a faith community tends to be associated with better health, with greater longevity, and with greater well-being. Now, if you're not religious, keep an open mind. Don't close your mind. You may consider applying some of these principles to your daily life. And there are forms of non-religious meditation that you might be able to engage in. Or you could engage in altruistic acts of, you know, volunteering in various ways to help out people in need, practicing forgiveness, these kinds of things. So there's a lot, I think, that even people who are not interested in religion or who don't believe in God, who can take something from this. Number 4, go to our website for information about further reading and further audio-visual materials related to this topic, and that's our website down there at the bottom, spiritualityandhealth.duke.edu. Okay, now in terms of clinical practice, now for if there are any healthcare professionals watching the webinar, this is where I'm going to talk about how you can apply this to clinical practice. So this part of the talk is more relevant now for health professionals, nurses, doctors, social workers, psychologists, etc. First of all, why address spirituality in clinical practice? Why do this? Number 1, many patients are religious and would like it addressed in their health care. About 2/3 to 3/4 of patients, when they get sick, really would like this to be addressed, would like their faith to be supported as part of their medical care. Now, bear in mind that there's about 1/4 to 30% of patients who want to keep these areas separate. Okay, about 30% of patients don't want to have their religious or spiritual issues addressed as part of their medical care. They want their minister to do that, and they want their doctor and nurse to stick to the medical. Okay, but 70% of patients really would like these areas to be less separate, would like nurses, doctors to support and to address those spiritual needs that come up in the setting of medical illness. Many patients have spiritual needs related to illness that could affect their mental health. And by addressing those spiritual needs, that will help that person to cope and adapt better to their medical condition. Poor mental health, if a person is not coping well, if they're depressed or anxious, then that's going to affect their physical health and their response to the medical treatment. So supporting that patient's spiritual needs, addressing those spiritual needs, are ultimately going to benefit the patient's response to the medical treatments. religious beliefs also affect medical decisions and may at times conflict with medical treatments. There was a study published in, it was a couple of months ago, I think it was May 2009 in JAMA, Journal of the American Medical Association. And what it reported was that religious people don't talk to their doctors about critical medical decisions that they're making. There's no communication between the doctor and the patient in terms of, for example, end-of-life decisions. Patients are a lot of times, and their families are deciding whether or not to continue life support or whether or not to insert a feeding tube to keep the person alive, whether or not to write a do not resuscitate order. These decisions are a lot of times based on religious beliefs, and they're a lot of times family are praying for a miracle, and they don't want to stop the ventilator. They want to do everything. You know, even if the patient's case is medically futile. In other words, if they're dying and there's nothing to do, and you're just prolonging their agony, you know, the family is praying for a miracle. But you see, since there's no communication, since the healthcare professionals are not dialoguing with patients about this, it doesn't get resolved. And so people end up, you know, getting treatment they don't want because this is not discussed. Also, in terms of mental health care, a lot of religious people, you know, they don't want to get psychotherapy because they're afraid that the psychologist it's gonna conflict with their religion. Because, you know, in the old days of Freud, that's exactly what it did. It really did conflict with the religion, and there were problems. Also, religious people don't want to take antidepressants sometimes. And so unless you talk about it, talk about the spiritual beliefs and how they might influence the medical decisions, then you can kind of come to some common ground. Then if you don't talk about it, you know, patients are just not going to comply. And they're not going to do what you tell them to do in terms of their treatment if it conflicts with their religious beliefs. Okay, also religion influences support and care in the community after the patient leaves the doctor's office or leaves the hospital. And so, therefore, addressing it in the hospital or in the doctor's office then can help to identify those spiritual needs that then can be addressed in the community once the patient goes back home. And then, you know, if the patient gives permission, then maybe the chaplain or the social worker can communicate what those spiritual needs were in the hospital, and then the pastor can then take over and then continue to support that person in the community. Now, what are we asking healthcare professionals to do? We're asking them to take a 2 to 4 minute spiritual history. This is not the same thing that a chaplain does, but what it is, it's something that the nurse or the doctor does. They take a screening spiritual history. It only takes a couple of minutes, and they identify what those spiritual needs are, and then they refer to a chaplain if there are any spiritual needs that are present. The chaplain then comes in and does a complete spiritual assessment, which is not much longer, but is probably, 10, 15 minutes, and they find out what the problem is, and then they're trained to actually address the spiritual need. Now, the purpose of the spiritual history is to obtain information about religious or spiritual background, beliefs, and rituals that are relevant to the health care of the patient. Now, if the patient indicates from the start that they are not religious or spiritual, then questions should be redirected to asking about what gives life purpose and meaning, and how can this be addressed in their health care. So that's why we're asking, this is really all that we're asking the healthcare professional to do, is to take this screening spiritual history. Now, we think that the physician should be the one taking the spiritual history. The patient needs to feel comfortable talking with the physician about spiritual issues. And the reason is because it's the patient's medical decisions are being influenced by their religious beliefs. But in addition to that, research has shown that the physician's medical decisions are also being influenced by the physician's religious beliefs. So, you know, if these decisions by patients and doctors are being influenced by their religious beliefs and they're not talking about it, then there could be some conflict here. So therefore, the doctor needs to take the spiritual history to get that dialogue going. So also, the patient's compliance with the treatments are influenced by the religious beliefs. Taking a spiritual history also enhances the doctor-patient relationship and may, in fact, just the spiritual history may, in fact, affect medical outcomes. Now, that's hard to believe that a doctor just taking a 2 to 4 minute spiritual history could actually affect the medical outcomes. But there was a study done in Indiana that showed that randomizing cancer patients to oncologists who either took a spiritual history or didn't take a spiritual history, in that study, the patients that got the spiritual history in 3 weeks, these are all patients with cancer, those cancer patients had less depression. This is actually significantly less depression, significantly better functioning, and they said that their relationship with their doctor was stronger and better. All of that was due to this 2 to 4 minute spiritual history that the oncologist did during the office visit. So that's pretty amazing what just taking a spiritual history can do. Also, spiritual struggles, if undetected, can adversely affect health outcomes. So not only is spirituality being used in a constructive way, sometimes it can be used in a negative way, and this is called spiritual struggles. Here's an example. This was a study that we did at Duke. This was published in the Archives of Internal Medicine in 2001. We found that patients who were wondering whether God had abandoned them, who felt punished by God, who questioned God's love for them, who wondered whether their church had abandoned them, who questioned whether God could make a difference in their condition. Those patients who scored high on these items were significantly more likely to die, everything else being equal, after hospital discharge. We followed those patients for an average of 2 years, and for every 1 point increase on this scale, this scale, each of these questions were worth 3 points, and there were 7 questions, so the scale ranged from 0 to 21. For every 1 point increase on that scale, indicating feeling some degree of spiritual struggle, there was a 6% increase in mortality. This was statistically significant, clinically significant, and independent of their physical and mental health. So identifying these spiritual struggles and getting these patients in to see a chaplain can be very important. Now, what do you ask in a spiritual history? This actually was published in JAMA in 2002. This is an article out of JAMA. First question is, what is the patient's religious or spiritual background? Are there any religious or spiritual beliefs that are used to cope with illness? Or alternatively, that may be a source of stress or distress? So you're going to want to see whether or not the religious or spiritual beliefs are being used in a positive way in coping, or alternatively, whether they are spiritually struggling, feeling like they're being abandoned or punished by God. Number 3, are there any religious or spiritual beliefs that might conflict with medical care or psychiatric care, or might influence medical decisions? Is the person involved in a religious or spiritual community, and is that community supportive? Are there any spiritual needs that may be present? and need to be addressed for health reasons. So that's the kind of information that you're going to want to acquire. All of it is relevant to the mental and physical health care of the patient.
Dr. Koenig?
Yes.
Is there any way, like for instance, after this webinar, physicians and nurses contact us, and is there any way we can get a copy of this to share with them so they can use it, it can help their patients?
Sure, there is. You can have a copy of this slide right here.
Oh, great.
Yeah.
Thank you.
You can distribute this particular slide.
Okay, thank you very much.
Sure. Okay. What else can you do besides taking a spiritual history? Support the religious or spiritual beliefs of the patient, both verbally and non-verbally. Okay, so this is patient-centered. You're not trying to convert these patients. You're not trying to get the patients to believe like you believe. You're trying to support the beliefs of the patient, the beliefs that the patient came into the hospital with. Those are the beliefs that you're trying to verbally and non-verbally support. Number two, ensure that the patient has resources to support their spirituality, however they define that. Any patients who have these spiritual needs should be referred to chaplains. Number three, accommodate the environment to meet the spiritual needs of the patient. Now, depending on the patient's religious background, this may be very important. If you have a patient who's an American Indian, or who is Islamic, or who is Buddhist, there will be very specific things, rituals, that they need to do if they're sick, particularly if they're really sick. And the hospital environment needs to accommodate those rituals. If the hospital environment does not do that, that will alter the atmosphere of that patient's illness and could seriously negatively affect it. Number four, be willing to communicate with patients about spiritual issues. Just be open and willing to do this. Prescribe religion to improve health. Pray with patients if requested. Now, those are a little more controversial, and I'm going to have to say no to those two. Actually, for number five, that's a no. We can't prescribe religion to improve health. That's unethical, and it's a use of religion for non-religious purposes, and we're not encouraging healthcare professionals to do that. We're only encouraging them to support the faith that is already there and to support that patient's spiritual journey in whatever way that patient wants that to be supported. We do not recommend that religion be prescribed. If the patient requests a prayer from the healthcare professional, we think it's okay. I would say that it's fine to pray with the patient. Just make it short, and only do it if the patient asks. Don't be praying with every patient, because if you do that, you can actually offend the patient, and you can offend them to the point that they'll actually sue you, actually put a lawsuit. There have been 2 cases in which this has occurred.
Wow.
When psychologists and medical doctors were insensitive, and they didn't take a spiritual history. They just said, well, I'm praying with every patient. I don't care. Well, they ran into a patient that did care, and they got sued. And the court cases were won by the patients. So the hospital system, the doctor had to pay because they were not sensitive to this issue of take a spiritual history, and if the patient, if you're dialoguing with the patient, it becomes clear that this is important to the patient, and the patient would like to have a prayer, and then it's fine. Go ahead and pray with the patient. It can be very comforting, but don't be don't be diving into that without any common sense. Otherwise, you could be in big trouble. Okay, what do you not do? Do not prescribe religion to non-religious patients. Don't force a spiritual history if the patient is not religious. Don't coerce patients in any way to believe or practice. Do not pray with the patient before taking a spiritual history and unless the patient asks. Do not spiritually counsel patients. Always refer to trained professional chaplains or pastoral counselors. Do not do any activity that is not patient-centered and patient-directed. Now, some healthcare professionals, sometimes patients actually would like to pray with their healthcare professional, but they're scared to ask. So sometimes I've recommended that if a healthcare professional wants to or is open to praying with the patient, then after taking a spiritual history, they can say to the patient, Mrs. Jones, I see that prayer is important to you and that you're a very religious person. I just want you to know that if a patient wants, I will agree to pray with them. Now, if that's something that you want, then the next time I come by, feel free to ask me, and we can pray. If that's not, then just don't mention it, and, nothing will happen. So what that does is that informs the patient that at least the healthcare professional is open to praying with them, and then the patient can take the initiative at some future time if that's what they want. And if it's not what they want, then they simply don't ask. Okay.
That
so
makes
now,
sense.
for further reading, here are a variety of books. Medicine, Religion, and Health is my most recent book. It kind of summarizes the research. The next one is Spirituality and Patient Care. This one right here, this is for the clinician. This is for integrating it into clinical practice. This is more for the researcher. This kind of summarizes the research in a readable format, but in greater detail. And there's not as much on clinical applications. This is entirely focused on clinical applications. For those who are counselors or mental health professionals, this looks at faith and mental health. This was actually a result of a white paper that I wrote for the White House faith-based, the Office for Faith-Based, I forget whatever that office is at the White House. They commissioned a paper on the role that faith plays in mental health, and this is the white paper, a book though that was written as a result. The Handbook of Religion and Health. This is kind of like the Bible for researchers in religion and health. This contains almost all of the research in religion and health, and the 2011 version, which I'm working on right now, will contain all of the research since this handbook was published in 2001. This handbook is about 750 pages. The 2011 will be closer to 1,000 pages. We'll have over 3,000 studies, detailed and discussed. The link between religion and health, Oxford University Press. This looks at the physiological explanations of how religion might affect health. This looks at immune functioning and other physiological parameters, trying to understand that physiology underlying this religion-health connection. The healing connection, this one right here, the healing connection. This tells a little bit about my interest in spirituality. It tells a little bit about my life story and the different struggles that I went through and how this kind of got me interested in the topic of spirituality and health. So if you want to get a bit of a background on me, then get this book here. This is written in a popular style.
And I enjoyed it.
What's that?
I just want to mention that was the book I read. That was what introduced me to you, and it was a really, really good book.
Oh, did you read that, David?
Yeah, this is how I got to know you.
Gosh, well, you know more about me now than probably my wife knows. I don't even think she's read this book, but in any case. Okay. the healing power of faith. This is if you've got somebody in the hospital and you want to inspire them, this is a good book. This was actually, although I'm the author of this book was actually written by a ghostwriter who is an editor at Reader's Digest. And he wrote this in a very easy to understand way. He explains the research, lots of stories. It's inspirational, and yet it's science-based. So I would encourage you for that one. Now, if any of you are actually interested in really learning about this area of research and understanding what these findings show, then we actually do summer research workshops here at Duke. They're 5 days. They're very intensive. They're from 8 in the morning until 5 in the afternoon. They include individual mentorship. They are, I teach about 90% of the courses, although we have leading researchers from Duke, UNC, and University of South Carolina at Charleston, as well as University of Maryland, come in, and we do this intensive training on learning about the research, understanding the mechanisms, learning how to write a grant, to fund research, how to conduct research in this area, how to do statistics and how to model the findings, how to write research papers and get them published, and really how to develop an academic career in this area, or how to just really learn about this work and really understand it well. So if you're interested in that, I've got an email address here. You can send me an email and I can show you. We already had our July workshop, but the August workshop is coming up. And if you're, well, actually, these are the dates for 2010. The August workshop this year is August 17th through the 21st. And send me an email if you're interested. It's completely full. In fact, it's got double the amount of people in it that we had planned. But I can fit you in if you really want to come. So in any case, it's important, especially for research. Religious involvement helps people to cope with stress. Research finds that good mental health and religion are connected. Again, not in every study, but in the majority of studies. More and more research is being published that documents this connection between religion and health. The effects on mental health and lifestyle that religion has translate into better physical health as well as better mental health. There are numerous applications of this research for people in general. However, there are also sensible applications of the research for health professionals in particular. So I think that's the end of the presentation. I thank you all for listening, spending your time, listening to this talk, and, you know, I wish you well, and thank you very much.
Well, thank you very, very much, Dr. Koenig. This has been fantastic. Thank you for your time, and we can see you put a lot of research into this. I know when we're going back and forth over the emails, that you were saying, oh, this is going to take you a lot of time to put together, and I was like, well, you do this all the time. You probably, this shouldn't be much of a stretch for you, but I can see now that you will really put a lot into this. So I really appreciate it.
Well, thank you, David. I feel like really, I feel appreciated. Just I felt very appreciated by you and by Sherry, you know, throughout this time, and I think you're doing a great thing, and I hope, you know, the webinars really go well.
Well, thank you very much. Thank you very much. Folks, we will not be able to take questions because Dr. Koenig had told us before this time that he needs to go to bed by 11 o'clock to get up in time for work tomorrow. Some of us have to work during the day, you know. So we're going to skip that part, okay? And if you have any questions, you can you can send them to our email address, and when Dr. Koenig has the time, he'll answer the questions. Dr. Koenig, could you give out your email address again? Someone's asking about that.
Sure, that's fine. If you've got a question, I don't mind if you email me. And my email address is Koenig, that's Koenig, at G as in George, ERI, DUKE.edu. So it's Koenig at GERI.duke.edu.
Great, and that will really be helpful. And thank you for agreeing to do that, to answer questions. I know with your schedule being so busy, that's hard, but we appreciate it. And I would love to speak.
David.
I would love to talk with you more. Just to talk about your book and your relationship with John Templeton, that remarkable man, and hopefully we can connect again soon.
All right, sounds good, David.
Okay.
Thank you, Dr. Koenig.
Okay, Sherry, thank you all. Have a
All
good
right.
night.
Good night.
Good night.
Bye.
Bye. Thanks.